Hey everybody, Dr. Abraham here with Clear Mind Psychiatry. We're going to get started talking about anxiety this week. And so I like to start with, what is anxiety really? Anxiety is worrying, and it's just not worrying too much. But it's also your body telling you that you may be in danger. So it doesn't necessarily that mean that you are in danger, but it's just your body's response for some reason. And I'm gonna get into why. So some of the common signs of anxiety would be racing thoughts, trouble sleeping, irritability, and muscle tension. So you can also look at anxiety as in anxiety between like stress versus anxiety. So stress responds to a specific situation, but anxiety can happen without a clear trigger. So like it'll just so happen. And the other part, a physical symptom of anxiety would be rapid heartbeat, dizziness, sweating, and some digestive issues. Like you may get an upset stomach, or you may immediately have to go to the restroom and don't know why, but suddenly you just have to use the restroom. And also things that can trigger anxiety would be caffeine, lack of sleep, certain medications, and trauma reminders. So that's what I was saying in the beginning. Sometimes it can just be your body's response to something that could have been traumatic that have happened, but it doesn't necessarily mean like that is the case. But you will have to explore, why. Now, if all of these things become a little bit too much, like happen over a year or 2 years time, or even over 6 months, that's when you know that you may have to get some type of a psychological help. So when I say that means either you can come to a person like myself or a psychiatrist for medication to be added on, or you can go to a psychologist, therapist, or a counselor to get the help that you need as well. So it's up to you guys on which route that you'd like to take and see what works. But if you have any questions about anything, please leave them in the comments and let me know what are your thoughts, and if you have anything else that you want to discuss. All right, later.